We're all hoping coronavirus will get under control and our lives can return to normal for good.
But researchers are warning about the impact of so-called long COVID, and some groups are getting hit harder. A new joint study finds it's more prevalent among women, Hispanics, and those over the age of 75. Long COVID is also hitting people with less than a high school education and incomes less than $50,000 a year. Plus, 27% of those with pre-existing conditions, such as cancer, heart disease, or other health issues. Grant Herms has been digging into what this means for those groups and public health. Grant, good evening.
Hey, good evening. Now, what this means is that doctors still have a long way to go in understanding this part of getting COVID. This study also very revealing about just how many of our friends and neighbors still don't have access to health care, something this virus has proven time and time again over the course of the pandemic.
It's the latest look into long COVID, persistent or lingering symptoms of COVID that last for days, weeks, even months after a negative test. The study looked at cases in Michigan and found that more than a third of Michigan patients hadn't recovered after a month. A quarter still had symptoms after 2 months, and more than 1 in 5 Michigan cases had lingering symptoms after 90 days. Researchers also finding long COVID hit women, those over 75, and the Hispanic and Latino community harder.
We're still learning a lot about long COVID and are seeing cases rise many months after they've been infected and recovered. Then they come in, I'm getting a little bit more winded going up and down the stairs, or my sense of taste or smell is a little bit off.
Dr. Felix Valbuena is the CEO of the Chas Center in Southwest Detroit and served the city's underserved Latino community. Valbuena also says long COVID has complicated health care beyond the symptoms for his patients, too. Lingering symptoms can make pre-existing conditions worse in a community where health care is often hard to get, leaving long COVID untreated and starting the cycle all over again.
We have a long ways to go. We have a long ways to go, and we know that having a chronic disease is going to lead to poorer outcomes if you do become infected with the COVID virus.
Now, the symptoms of long COVID seem to be just as different as getting a positive case from person to person. The symptoms range in the gamut here for everything from stomach problems to trouble breathing to memory loss to loss and taste of sense and smell as well. Back to you.
Grant, what are doctors saying they need to know if you think you have symptoms of long COVID?
Well, right now they want to know anything that you can tell them about your symptoms, even if you had a mild case or you found out you were asymptomatic and tested positive and then negative later. They want to know all of that, especially if you have those certain comorbidities we just talked about here, because those things could impact you a little later down the line. They just simply don't know yet.
Yeah,
Back to you.
Really interesting. Okay, Grant, thanks.